everyone. Amanda here, CEO and co-founder of Bari Better Inc., where we provide online bariatric coaching in English, Spanish, and Portuguese. And today I have the pleasure and honor of interviewing one of our board advisors, so Dr. José Diego Botezelli. He is originally from Brazil. He's now living in Canada, and he has a PhD in physiology and metabolism. And it's been a great pleasure. We've been meeting on weekly basis on our calls, and we talk a lot about bariatrics. And today's topic of our interview will be bariatrics and exercise. And I also would like to tell you that Dr. Botezelli, he prescribes online exercise and nutritional plans. And today I have the pleasure to have 4 segments with him in this interview. And before we get started, I also would like to talk about Bari Better, where we do not provide any medical advice, and we only provide general wellness and lifestyle coaching, which should not be constructive medical advice and should not replace your consultation or any advice from a medical professional. So you should not rely on Bari Better or any information provided by Bari Better Inc. for any medical decisions. And also all the interviews that we perform Bari Better are for information purpose only, and Bari Better Inc. is not responsible for the information provided by the person being interviewed. So with that being said, welcome Dr. Botezelli, and it's a pleasure to have you with Bari Better today. Thank you so much with us.
Thank you so much, Amanda.
I would like to have you introduce yourself a little bit and give us a little bit more of your background, and so the viewers and the listeners can get to know you a little bit more.
Yes, perfect. I'm Dr. Botezelli. I have a bachelor's in kinesiology and a master's and PhD in metabolism, physiology and metabolism. I have a postdoctorate in nutrition, exercise, and metabolism in the University of Campinas from Brazil, and another postdoctorate at UBC, where I was studying cell physiology. Now I have my own company. I help people around the world, losing weight. I have clients in Dubai, Ireland, Australia, Brazil, South Africa, England, Italy, Spain, etc. I can't remember where is everybody. And my main strategy is trying to bring new strategy and new habits for people to lose weight in a healthy and reliable and sustainable way.
That's a great point. Health, sustainable, reliable way. And let's go to our first question on our session today. And I would like to hear from you with all your background and your experience. What is the importance of exercise during the pre-op phase of bariatric surgery? So before you even get your surgery done, how important is it for you to have exercise as your routine before bariatric surgery?
Perfect. So if you're going to a bariatric surgery, it means that you are overweight or obese, right? Mm-hmm. And the problem with overweight or obese, you have insulin resistance, you have some problems, and you have usually bad habits. And when I say bad habits, it's not like judging or something like that, but it's not correct habits. So we need to produce new strategies. We need to build new strategies, and we also need to improve your overall health. This will help first. Will make your surgery more successful. We have less complications in the surgery, less problem. Also, doing exercise, especially physical exercise that will make you to produce muscle mass, like strength exercise, functional. You can just use your body. You don't need fancy equipment. You don't need to run 10 kilometers per day. Just use your body. Our body is a pretty massive weight, so we can use our body to do and work in balance, work coordination, work rhythm, work everything. And this will help our muscle mass to get more healthy. So when you go for a surgery, one of the things that usually happens in bariatric surgery, you can lose a lot of weight, but usually this weight is fat and muscle, okay? Starting a workout routine, an exercise routine before the surgery will allow you to recover the muscle mass faster and also prevent this muscle breakdown that's a huge problem after the bariatric surgery. As we know, around 80% of people, they do bariatric surgery, they become obese again. They do not reach the same weight, but they become obese again. So if you're 300 pounds, you do a bariatric surgery, you can lose 150, 100 pounds, for example. But after 4 or 5 years, because you do not change the causes of the obesity usually become obese again. And we want to prevent this with exercise. So exercise is a really good manner to lose weight, of course, to burn calories and to control our hormones, and also to improve the results of the bariatric surgery. The bariatric surgery itself, it's a good strategy to make you lose weight. It's a really good push. It's a really good way to kickstart, but it's not the only way. So we need to remember that's one strategy, but we need a life change, right? Starting physical exercise is super important. We are producing new habits, we're creating new habits, we're training our body for what's coming after the surgery. Doing exercise, increasing our basal metabolism, increasing our muscle mass, increasing our routine, and change our life, right? Change our routine and change our life.
Yeah. I love what you said. I mean, you already know my story. You and I work together. I follow your plans, your exercise, and your plan and all that. And it's great because you're in Canada. I'm United States. Yeah. We would never be able to meet every week, right? In a weekly basis or all the time. So I greatly appreciated how everything is done online, and it's really impressive. And one thing that you and I talk a lot about is habits, right? And that's exactly the point here. And for those of you who do not know, I know you know my story, but I also had gastric bypass bariatric surgery. So I'm also a patient and a bariatric coach. So I help clients that are going through this process, either pre-op, right, or post-op, who already had the surgery, or clients who had to go through a revision, whether it is because they had regained so much weight and they have to go back for another procedure, or because of other anatomic or issues that the surgery had. So it's very important to talk about habits here. And I remember sharing with you too that, before my surgery, I was already doing exercise. And obviously now I have way more endurance. I can do way more. When you give it to me, the prescription, I'm like, yes, now I can do things that I never thought was possible for me to do it. But it's exactly that. It's the habits, because I remember my bariatric surgeon telling me, Amanda, just go to the gym or just do exercise. And it doesn't have to be spending 10 hours in the gym, 2 hours in the gym even. People have misunderstanding of that. But it's really moving, starting to move. And of course, knowing your limits. I always tell my clients, make sure with your doctor that you can, or what exercise you can or you cannot do with your limitations. But for me, it was really importance of having that activity even before surgery. Another thing that my case, right, every case is different, but to decrease the fat around my liver before my surgery, my doctor also prescribed me 2 weeks on protein shakes before my surgery. That was a way that his team had it for me to be able to have, the decrease of the fat around my liver. Again, that was my case. That might not be the same as you listening to me or other viewers, right? But that was one thing that helped me pre-op, right? Something that I did it even before my surgery happened. So what you were saying, it's so key, right? Just really make sure that we don't have bad habits.
Mm-hmm. Yeah, in the same routine. Of course, with the bariatric surgery, the gastric bypass, you won't be able to eat too much in one time. But I know patients in Brazil, for example, after the gastric bypass, they're drinking condensed milk, right? Because they're not preparing their mind, because it's a change of life. It's a change of new habits. We work with rewards. That's how our brain works, okay? If you get a new iPhone, if you get a new car, etc., etc. And this kind of rewards, if you're depressed, if you're anxious, if you're tired, if you're sad, and then you come home. Yeah, if you're happy, right? So when you come home, for example, after a day of stressful work, and then you get a sweet, something sweet for you, watching Netflix, a TV show that's really nice, you like it. So this is the reward. So we associate this habit of eating something it's not healthy, but our brain loves, because it's evolution process, right? We do not find any kind of food, any sort of food in the nature that has sugar, salt, and fat, as we have in chocolate, for example. This is the nature, is golden. It's so much energy inside a piece of cookie or a piece of candy. So when you eat this, although cannot be that pleasure, because we just eat this all the time, for our brain, inside of the neurons inside our brain, this is pleasure, this is reward, this is okay, we found the golden the golden here, okay, the golden pot here, because it's in the nature. Right now it's winter here in Canada. It's starting the winter, it's autumn, but like cold outside, is dark, it's gray. You can find food. It's really hard to find. You don't have fruits. You don't have even leaves in the forest here. So you don't have energy. So all the time that you have this energy is like a reward. Okay, we got like a huge amount of energy, like super high energy, insulin peaks, changing all your hormones. And usually you were eating this watching a series or playing a game or watching a comedy. And this is like a reward mechanism that's really, really hard to break. So we need to break this, like eating healthy, trying to do exercise. So this will break this kind of reward system that's like of a bad habit. And then like with exercise, for example, it's hard. I know I love doing exercise. That's why I do what I do. But I know like for 80-90% of people, it's hard to do exercise. And why it's hard? Because they do this not that like something that they should do for their lives. Okay, I usually compare this to work. I love my job. Okay, but if I could like make money like doing nothing, everybody would like, okay, I want my salary and I would just stay at home, right? But it's the same with diet. We need to find like the pleasure things in a diet, or same with exercise. We need to find pleasure exercise. Remember like one of the first like things like that I told you is like, okay, we can do this, we can do weightlifting, we can do functional exercise, but you need to find something that you like. And you were saying that you love basketball, for example. And that's you need to go to basketball. You need to play. You need to find a reason to do exercise. And weight loss is kind of like a shallow objective, because when you lose weight, for example, I want to lose 10 kilos, and then I lose 10 kilos. And then, so what? So you don't have the target anymore. You got the 10 kilos, whatever. And then whatever, I'm here. So you start the old habits again. So you need a purpose to do that. Like even the physical exercise. Why I want to start the physical exercise before the bariatric surgery? Because I want to change my life. I want to get like a better surgery. I want to have less chances of risk during the surgery. And you start to prepare your body. The surgery itself, it's a pretty stressful situation. If you, after the surgery, you need to change all your routine. You can't eat because your stomach's like smaller now. You can't eat. Now you have to exercise. Now you have to change everything. It's too many changes at like one time. So start before, start earlier. So we can start with exercise. You can start like doing diet even before. So the stress is like you just separate the stress. So we have like small stresses and small changes all the time. It's hard to change everything in your life just like from one day to another. We see this all the time, you know.
That's why we just need that one little bit at a time, but consistent, right? And that is such a key comment that you made for getting exercise even before you get to your bariatric surgery. So thank you. This was a great segment. I greatly appreciate all your input on the exercise before having your bariatric surgery. And I appreciate everyone's time with us today. And now we're going to go for our segment number 2.